Dear esteemed guests, good morning again. I would like to once again apologize for the delay and thank you for your patience. Before starting the presentation, I would like to ask you to please use your masks, 1, 2, to ask for translation devices if needed. Also, if you had any questions, please inform my friend Mustafa. So, for the first presentation for today, we have Mr. Jir Azad Anbar, who is a clinical laboratory specialist and university lecturer at HMU, will be giving a presentation on the topic of development of home care in Kurdistan. I would like to welcome Mr. Jir onto the stage so that he can take the floor. Welcome, Mr.
Good morning, ladies and gentlemen. It's an honor for me to be here and give a personal perspective on the development of home healthcare in Kurdistan. Can we maybe start there? So as I've clearly written down on the left side of the screen, from the right side for you, it's a personal perspective. This is due to the lack of data available in our region for the development of medical services in general. There is a bit of data, but it's insufficient for us to create graphs and analysis and make conclusions out of them. Before starting the presentation, I'd like to briefly let you know who am I and what careers have I had until now. So I have studied my bachelor's degree in the Netherlands in biology and applied medical laboratory technology in Avans University. Thereafter, I did my master's at Erasmus Medical University in infectious diseases and immunodeficiencies. Currently, I am working at Hawler Medical University in College of Health Sciences. I am a lecturer there. I am also the founder of Teams 8 training and consultancy group with a focus on medical management training and patient care training. Currently, I am also the general manager of a newly established medical center called Proximal Clinics, where we mainly focus on standardizing healthcare services. In the past, I have had several positions in the Netherlands, as well diagnostics, as well as research development technician. I was quality assurance and laboratory manager at Hawler Medical Research Center, HMU, and I was business development manager at Media Diagnostic Center. So, why home healthcare? This picture actually represents a situation that I've been in, and actually motivated me to look into the development of home healthcare services in Kurdistan. This is actually not the actual situation, but it was quite similar. One day when I was working, supervising a team, quite panicked patient came and searching for the manager for what nobody knew. When he started talking to me, he simply requested if we could take some blood from his father, who's in the car and he cannot come out of the car to perform the test. Of course, very, very simple question, very simple request, so we did it. Out of curiosity, I just also went outside to look at the patient. It was something a bit strange for me. Actually, I saw a similarly dressed elderly man crying while his blood was taken. It really touched me. After the procedure was done, the blood was taken, I started talking for a few minutes with this gentleman. I asked him, "Why are you crying, Mama?" He told me, "I have been to 2 other hospitals in the past 2 hours, just begging them to come out of their laboratory to take my sample." It really touched me. I almost started crying. I didn't cry, but it still touches me when I tell the story. This is when I started to be interested in home healthcare services and exploring the possibilities to develop that in Kurdistan. And this was about 5 years ago. So briefly, what types of home care do we have if we talk about home care? We have something which is called home help. This is a basic home care service. It includes rehabilitation regimes, assisting in personal hygiene and care, and even shopping, transportation, cleaning, cooking, tidying tasks, and other tasks. So this is basically to help someone with some kind of disability to get on with their life. Then you have also nursing, which consists of several obvious nursing tasks, including wound care, nutrition therapy, injections, educating the patient themselves and their caregivers, their relatives and their family, and monitoring serious and chronic illnesses. We also have diagnostics, point-of-care testing, which basically means the quick tests that can be done at home, like monitoring blood sugar, and many other tests are within the same family of category of testing. Sample collection to be transported to specialized laboratories to perform the test, portable ultrasound, portable X-ray, portable ECG, and so on. Then we have primary care physician visit to the house or family medicine visit, who can treat minor illnesses, answer health questions and concerns, conduct health checkups, and provide referrals to specialty physicians in case needed. So, what are the benefits of home care services? Well, mostly it is cost efficient. Why is it cost efficient? Because you do not have to stay in a hospital, and you do not have to endure the costs of staying and reserving rooms in a hospital. It also promotes healing, because it's much easier to undergo a healing process while you are within your own environment, your own family, your own house. It also offers individualized healthcare, tailored to the client's needs, because if there is a nurse at home, he or she can give full attention to that patient at hand at that moment. It also reinforces the supplemental care provided by the family and friends, which without a professional's help can actually go into a wrong direction. Of course, it also reduces the burden on a healthcare system, provided it's managed properly. Approximately 5 years ago, as I mentioned before, home healthcare was completely or not really existing in Kurdistan. There were some independent healthcare workers who, through contacts and through family and friends, provided home care services, but these were not agencies, these were independent workers. And also non-medical family members caring for the patients at home, which is still happening, of course. After the COVID pandemic, several independent home care agencies started to be interested in providing home care services. These were primarily focused on diagnostic services and sometimes nursing services. Also doctors, physicians started more frequently visiting home. Hospitals are nowadays also providing home care services, and also diagnostic centers, they mainly focus on sample collection to bring it back to their laboratories and perform the tests. We have several challenges currently in Kurdistan regarding home care and home healthcare services. We do not have a robust communication between referring physicians and the home care agencies. This is actually, in my opinion, the biggest challenge, discontinuity of healthcare services when home sample or home healthcare services are provided. No regulations from the government. I actually double-checked last night. There are some ways where you can actually legitimately open a home care service agency, but there is no true regulations for it at the moment. There are no standards, no benchmarks, and also no inspections for quality control and managing the quality of services provided. There is inadequate training and education for healthcare professionals. This also I surveyed among freshly graduated physicians, nurses, laboratory students, which I actually am a lecturer for. They do not get this. There is no curriculum for that at universities and other educational institutions. Patients might underestimate the service. It's quite a new service. I talked to several friends of mine who are physicians, and they actually, this was one of their biggest concerns. Because of lack of awareness and lack of, let's say this is a new service, patients are underestimating the service. Intervention in medical decision-making by family members. This is also a big concern. This is for home care services and also for other medical services a big concern, where you can imagine you might have heard your family and friends have a patient and they say, oh, we heard that this is not a good medicine, try this, and eventually it turns out to be a disaster for the patient. Finally, very difficult to find home care agencies due to inadequate online presence. I encourage you to search on Google in Kurdish as well as in English to find the healthcare service agency. You will get one or two links, but the rest of the links are Facebook and Instagram and various different websites which have nothing to do with home care services. As a reflection, this is a web page which will be the first web page shown on Google search if you search in Dutch language for home care service. This is the home care service web page from the Ministry of Health from the Netherlands. So this is immediately the first result, and it actually gives a very clear and simple explanation how patients can achieve home care services. The same goes for NHS in England. If you just search Home Care Services England or NHS, this will be one of the first pages which is shown. Again, very clear explanation in simple language for the people in need of it. First steps in implementation of this service. Well, first of all, we need regulations from Ministry of Health. Regulations which will actually motivate standardized healthcare services in the homes and comfort of the patient. Inclusion of specialized home care courses in the curriculum and medical laboratory medical education by Ministry of Higher Education. This is actually as a reflection in the Netherlands, me being from or having lived in the Netherlands for quite some years. There are university bachelor degrees focused on home care services and also other lower degrees, not only a course. Increase accessibility of home care services by the provision of subsidies. Again, in many European countries, including in England and in the Netherlands, the government provides subsidies for patients and also for the home care service providers. To encourage this service. Increased use of healthcare information management system to promote the continuity between provider and referring physician. I think this topic has been discussed quite a lot during the past 2 days of this excellent summit. Promotion of home care through awareness and education. This is more meant for the patients themselves and the users of this service. As a final slide, I would like to show you, again, this is actually from UK. It's so visible, it's so open, and so much promoted and encouraged the service that there are websites which show that, as you can see here, the top 20 awarded winners just announced in 2021 who provides home care services. This is called visibility. This is called ease of access. You just have to type 2 words into Google and you will even be able to compare and to choose the best service suitable for you financially and looking at any other aspect. So my final advice, and as sponsor of this event, proximal clinics, which again, it's a newly developed medical center which focuses on standardization of healthcare and also education and continuous development of employees in the region. My final advice is trying to improve the service through training, through standardization. I do understand this is quite costly, this is quite expensive. However, I think we are in need of standardization and in need of provision of good home care services. There is a big pool of interested customers who are truly in need of the service, and if we do a little bit our best, we'll be able to improve this standard in Kurdistan and reduce the burden on the hospitals and any other healthcare providing, let's say, places. Thank you very much. It was a short talk. I am curious if there are any questions. Okay, thank you.
Thank you so much, Mr. Jir. It was an honor to have you here. We will start with our next panel shortly. Thank you for your patience.